Good morning. My name is Ishwar Singh, Group 3009, and my topic is diabetes. So, firstly, we discuss about the definition of diabetes. Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin is a hormone made by the pancreas, help glucose from food get into your cells to be used for energy. Second, we discuss types of diabetes. There are two types, type 1 and type 2nd. The body, firstly, type 1 diabetes. The body does not produce insulin. Some people may refer to this type as insulin dependent diabetes, juvenile diabetes, or early onset diabetes. Causes of diabetes 1 occurs when your immune system, the body's system for fighting infection, attacks and destroy the insulin producing beta cells of the pancreas. Then the history. The term diabetes was probably coined by the Apollonius of the Memphis around 250 BC. Diabetes is first recorded in English in the form of diabetes in medical text written around 1425. It was in 1675 that Thomas Wills added the word mellitus to the word diabetes. This was because of the sweet taste of urine. Then the current situation. Currently, diabetes has risen from 108 million in 1980 to 422 million in 2014. The global prevalence of diabetes among adults over 18 years of age has risen from 4.7% in 1980s to 8.5 in 2014. This is the graph of the proportion of diabetic patient. The first graph shows patient about not awareness of diabetes, and second graph shows regularly treated. First graph shows 59.4% of males not aware and regularly treated are 36.9. Demography. According to the World Health Organization, around 1.6 million people worldwide died due to diabetes in 2016. It is estimated that 425 million are living with diabetes all over world. By 2045, projection shows the number rising to some 629 million diabetes patients globally. This is the graph which shows diabetes in healthy body weight and who exercise regularly. This is in 2012 1.7 million who maintain healthy body weight and 3.3 million in 2031 who exercise regularly. Legislative laws. Eliminating disparities in diabetes prevention, access and care act, protecting access to diabetes supplies act, Medicare CGMA access act, preventing diabetes in Medicare act, access to quality diabetes education act, programs, American Diabetes Association Education Recognition Program, American Association of Diabetes Educators AADE, Diabetes Self-Management Education Support, National Diabetes Education Program, National Diabetes Prevention Program Customer Service Center. Policy and European Action Policy from 2012 to 2015 for implementation of the European Strategy for the Prevention and Control of NCDs was endorsed at the WHO Regional Committee for Europe at its 61st season in Baku in September 2011. The action plan lays out an integrated approach to the prevention and control of NCDs, specific actions to address the priority disease. The strategy is to empower people living with this condition to manage their own life. Preventions: cut sugars and refined carbs from your diet, work out regularly, drink water as much as you can, lose weight, quit smoking, and follow very low carb diet. Conclusion: diabetes is considered to be a major health problem that is predicated to TUM into global epidemic in developing countries. The number of people with diabetic gradually increasing day by day, as well as complications like like diabetic retinopathy will continue to rise. Retinopathy is the potential sight reading condition. It is a significant public health program all over world. Adequate treatment of the risk indicators might prevent and reduce the burden of these diseases and improve the quality of healthcare services. These are my references from which I took help, and thank you at last.